marketing. It's a major component of the medical revolution. Yes. Are there any journalists in the room? If you'd like to go to the other side, because Mr. Acquayer would like to see you. Yes, hello. So first of all, I'd like to thank Guy for inviting me to organize this round table focusing on new technologies, communication. Many people know that internet is my profession and my hobby. It's the weekend, so that's just as well. We're going to try with this panel to go beyond the conventional debate about information that is not of good quality. I would really like at the end of this round table discussion I would like you to have taken up an idea, and that is the absolute intimacy between communicating and providing healthcare. We always say in France that communication has not been present enough, has even been absent in training health professionals. Today, it's another level of communication that we're seeing through internet. The collection of information can only be provided by patients, can help scientific progress. This is what we'll be seeing throughout the round table. We see as well that communication between professionals and patients is primordial for things to go well on both sides of the fence. I'd like to thank the panelists for being here with us. We've got Martin Vial, Gilles Friedman, Ségolène Aimé, Étienne Cagnard, Paula Hickson and Thierry Zilberberg. I would like to begin by asking a question to the person representing the NHS. Paula Hickson.
Can you explain to us how it is that the British government undertook to provide healthcare information for all of the patients with its multi-channel approach, which is the website, kiosks, telephone, switchboard service?
Thank you very much. Well, NHS Direct was set up about 10 years ago with a very much of an aim to be available 24 hours a day, 7 days a week, every day of the year, and to provide healthcare and advice, and information. The importance was to provide a new channel, a channel that is immediately available to somebody in their own home, and with the aim to give the patient more information, more access, but also to give the medical profession another route, so that when somebody has a question, maybe we can deal with that question ourselves. Maybe they do not need to see their doctor. Maybe we can give them the information that they need. We handle 25,000 calls a day. That's 9 million calls a year. Our website attracts 1.5 million visitors a year. We are working very hard to be where the patient is. So for young teenage girls who need advice on a new vaccine against cervical cancer, we are on Habbo Hotels. This is a game they play. We have adverts in their virtual world where they can access information in their time, at their pace, in their sort of language. We have chat rooms where people can get contraception advice by talking to a trained nurse, but again through the internet. Something that maybe is confidential, something that is maybe difficult to speak to a doctor about or a professional about, they can do in the way that they want. And the final thing I want to say for now is that during the recent flu epidemic over the summer, the internet and the telephone service was absolutely essential to people to understand. We had very high demanding calls. So, for example, in a normal day we might get 500 calls about flu. We had 10,000 calls just about flu on our busy day. 1.5 million people looked at the internet in one day to have more information. And we have on the internet self-assessment tools. So you can look up and you can check your own symptoms. The system will guide you through professionally developed algorithms developed by doctors and check their own symptoms. And people were using these, 180,000 people use this in one day, compared with maybe a few thousand in a normal day. The health system would not have been able to deal with those sorts of volumes at that peak of anxiety for people, the medical profession was able to deal with the people who were seriously ill, who had maybe other symptoms, who have other conditions underlying, who need to be treated by a doctor. Our nurses and our health advisors could help all of those other people, and the internet again. And I know today we have talked about the economics of the system. I mean, for me, there are three things. There's about having a clinically safe and effective service and contributing to the whole medical profession in that way. There is about making the system available to the patient, being a very focused patient system. And then there is contributing to the economy, to the financial economy of the health system as a whole. We think these are very general numbers, not very precise, but maybe a face-to-face visit might cost £75. Maybe to speak to have a consultation with a nurse over the telephone for 10 minutes, maybe it's £25. To be able to access the internet is maybe 25 pence. The economics of this are very important, as we've talked about this morning, with a growing demographic, with people living longer, with people needing more advice and help, with families being separated out. Young people need more advice, and maybe their families are not close, and this is a way they can access that information. And we can help people to look after themselves in a way that means that they stay healthy, which means that they need less access to expensive other parts of the health service. So, for example, we have a care management system for diabetics. We have nurses who ring them in their home, who talk to them about their care, make sure they're taking their medication, and this is in alliance with a private sector organisation. And as a result, these people stay more healthy longer, and they access expensive medical support less often.
You have direct TV too, you might have mentioned that. Or?
We have, it's only a very small thing. It needs to be completely redesigned for the new internet world. It was useful before, I think TV on the internet was so good. Now it is much more about being able to access through the internet, video, to be able to watch a video about a subject you're interested in. The TV bit was there as well.
Donc nous venons de voir avec NHS Direct.
We've just seen with NHS Direct that they've used the NHS brand, which is very well known by the British people, to create, first of all, a portal which goes much further with different steps in terms of health management. I'd like to turn now to Sigolène Aimé, and I'd like to ask the floor a room. Who here, which health professionals here have been in contact with somebody suffering from a rare disease? So it's not as rare as that. It was not as scarce as that. And that was my objective by asking this question, because Ségolène has listed 6,000 rare diseases, a lot more than the World Health Organization. Mr. Donzon, can you explain to us how you introduced this personal initiative to this public mission? Well, I wasn't expecting that question. So I am a genetician. I've had to diagnose illnesses that I'd never met before throughout my career. And I concentrated on access to information in order to do my job as a doctor in the 70s. I've almost got 40 years of experience behind me. So in the 70s, I was dreaming of internet. I didn't know it was going to exist one day. I said to myself, if we had access to all of this information that's in the medical books, that would be a real bonus. So personally, I computerized the medical books that I read for my own profession. And so I became a specialist of rare diseases. I listed these diseases because I had a good tool. And when the Minitel arrived in France, and when internet arrived, of course, I put my personal database online, available to everybody. So it's now a site that is in 6 languages and that looks at 6,000 different diseases. So, of course, this can contribute to diagnosis for rare diseases, but it also helps